Hello, welcome back to my channel. This is Simplifying NCLEX, and today we'll bring to you a very important topic you need to know before your NCLEX examination, and that's otitis media. So it's a very brief one, and we'll be discussing it under the subtopics. So definition: otitis media is just the inflammation of the middle ear, and by the middle ear we mean the eustachian tube. And risk factors: it can happen in both children and adults, but mostly children. So children, being a child that is less than 2 years, is a very important risk factor we need to know. Another risk factor are children who are taken to the daycare center. Is an NCLEX tip, because children, are susceptible to infection, and when they play together, they can actually transfer this infection to each other. So otitis media can be a bacterial infection or a viral infection, but the more offender is bacteria. So children can easily share this infection between each other. Another risk factor is children who are amongst adults that smoke. So these children are not the ones smoking, but they live with adults who smoke. That child has a high tendency of developing otitis media. And then children who are not fully immunized. Children who are not fully immunized have a low immune system. Their immune system can be compromised easily, and they will develop this inflammation of the middle ear. Okay, so if we have children who are not fully immunized, children who we take to the daycare center, children who have a low immunity, and those ones who are less than 2 years old. These are some of the risk factors of children who can get otitis media. Like we say, even adults can get it, but it is mostly seen in children. Now, for the diagnosis, we usually do the otoscope, which is just like using that otoscope to look into the middle ear, because we want to look at the clinical manifestation, if the eardrum is bulging, if it's inflamed. And another way we do our diagnosis is through the clinical manifestation that we'll be discussing shortly. So if to think about it logically, this is a child who is under 2, and this child is going to have inflammation of the middle ear. What are the clinical manifestations that will come to your mind? You're going to see that this child might not be able to verbalize this pain, and it has to do with the ear. So you're going to see this child pulling and tugging on the ear frequently, and most of the complaint is going to come at night. Why at night? Because that's when the child wants to settle down, and if the child lies on the affected ear, the pressure increases and this child is in a lot of pain. So that's the child who is going to be crying a lot. That's the child who is going to be fussy, irritated, restless, and that's the child who might have discharge, which might be purulent or not, coming from the ear, the affected ear. So one important symptom manifestation you're going to see is that this child is going to be pulling or touching the ear at intervals, showing you that he has pain in the ear, because the child cannot verbalize. And another thing these children do when they have otitis media is to roll their ear from one side to the other, all because they want to see a more comfortable position and be able to bear the pain. And then we can have high fever under the clinical manifestation. It's important I mention as an NCLEX tip that this child who is having otitis media is going to come with a lot of pain. But the moment this child stops complaining of pain, we are worried. Just like in appendicitis, when the individual stops complaining about pain, we are so worried. In acute otitis media, we are worried when the child who is having acute otitis media stops complaining of pain, because that means that the eardrum must have ruptured. So we want to investigate quickly. It's important I mention that otitis media can be acute and can be chronic. So most of the things you've heard me talk about today is about acute otitis media. For the chronic one, the acute otitis media is going to come with pain, is going to come with this fever we're talking about, and all the clinical manifestations I've just said lastly. But for the chronic one, you might have this child having prurient discharge, but there's no pain and it might not be infected. So this child has had repeated accounts of acute otitis media. It now becomes chronic, that this child can start draining prurient discharge from the ear without feeling pain and without that discharge being infected. So for the nursing intervention, the most important thing we do is, we had said that it's a bacterial or viral infection. We usually try to, if it's a bacteria, cover the patient with antibiotics. And then another thing we do is to kind of educate them, encourage this patient, the parents of the patient, on the importance of routine immunization, because like we said, one risk factor is that child who has not gone through the full immunization schedule. Now, we are not going to insert anything. If we are doing the otoscope, when we talk about diagnosis, we want to make sure to just look at the middle ear, but we're doing it professionally. We are going to be talking about instructing the parents not to put anything like your earbud into the ear, because that eardrum is delicate at that time and can easily rupture. So we don't want it to rupture. Okay, so for that, most of the things we do is to educate. Our treatment is usually coverage of antibiotics, treating the pain, because this child is going to be in a lot of pain. So we can give pain medication, we can give antibiotics, and it is important in the treatment that you tell the parents of this child to return back to the clinic if there is no improvement in the clinical manifestation, the pain and everything that the child is exhibiting after 72 hours of commencing antibiotics, because that is showing that the antibiotics is not working and we need to investigate further and know what to do to help the child. Now, your NCLEX tip lies on your prevention. Okay, what are we going to talk about in prevention? We are going to start from the grassroots, our education, talking about immunization, trying to tell the mothers not to put anything into the ear when we have a child with otitis media. And then we're going to educate those mothers, the caregivers, on the importance of stopping smoking, because we said that a child who is amongst an adult or adults that smoke has a high risk of what? Of getting otitis media. And then we want to limit the contact that this child makes with the day care center. So if there is any way we can keep the child more at home and less at the daycare center, that's an option we want the parents to take. And we want to teach the parents that swimming does not cause otitis media. And that's an NCLEX tip, because NCLEX will ask you if what response from the caregiver will elicit further teaching. That's showing that the caregiver has actually said something that is wrong about the disease condition. So when you have the caregiver talking about limiting the time spent in swimming or not allowing this child to swim, you are going to correct that, because otitis media is not caused by swimming. So you want to correct that. All right. And then we encourage these mothers to do exclusive breastfeeding, because exclusive breastfeeding helps to improve the immune system of the child, and that's what we want. Also, we are going to tell the mothers to be careful when it comes to positioning. Now, in positioning, I will talk about breastfeeding. The child is not supposed to lie flat to breastfeed. You make sure that the level of the head is higher than the level of the rest of the body. So keep the child in a good position in breastfeeding. And for the bottle first child, you want to sit them upright. Tell mothers that it is not right for them to put bottles inside the baby's crib. Okay, don't leave bottles inside the baby's crib overnight, because babies might pick up the bottles and lie down to drink them, and that's not healthy. Remember, it can lead to infection. Teach them hand washing, very important, hand hygiene. Teach them hand hygiene, because we have said that otitis media can be a bacterial or viral infection. It means that if it's a bacterial infection, we need to keep our hands clean, because that bacteria coming into the body of the child might cause otitis media. So that's some of the preventive measures that we can take. Now, I have told you that swimming does not cause otitis media, so I will just talk about the otitis externa. This is the one that is caused by swimming. So otitis externa is when we have continuous moisturization of the external canal of the ear. So, and we see that in individuals who swim or have something to do with water regularly. So they develop this otitis externa, and the people at risk, like we said, are individuals like people who swim a lot, who take it up as professionals, divers, and then people who use cotton bud regularly. So these are the people who can come down with the otitis externa. And like I said, it is caused by the fact that the external ear canal is always moist. So what we do is that for the divers, for the professional swimmers, we have the ear plug where they actually block the ear canal before they go into water, and we still have the cleaning of the ear canal with isotonic solution after swimming, just to make sure that it is well dried. So that is your otitis externa. Otitis externa is important to know it because that is the one that can be caused if someone is always swimming or moisturizing the ear canal. Now let's talk about the eardrop. What are the important things you need to know in NCLEX about eardrops? Okay, for the eardrops, we have a specific way of dropping the eardrops for the child, okay, and for the adults. And then you make sure that if you want to instill the eardrop into the individual, that the individual keeps it or lies down 3 to 5 minutes after the eardrops has been dropped. And before you put the eardrop in the patient, make sure that the eardrop is within room temperature. Okay, so that is all I have for you today. Like I said, it was a very brief one. If you have not subscribed to my channel, please do so. Subscribe to my channel and encourage me so I can put in more videos. Thank you so much.